Have you ever accidentally cut yourself with a knife while preparing dinner? Or fallen down and suffered a wound that you just can't get to stop bleeding? Then you've come to the right place. Accidents happen, and lacerations account for approximately 8% of ER visits every year. So, what can you do at home, and what might you expect if you come to the ER? Stay tuned to find out. Now, the first thing you can do at home is to hold direct pressure. The average bleeding time for a normal adult is between 1 to 9 minutes. If you take an aspirin or an NSAID, this might go up to 15 minutes. Now, it's important not to peek or look underneath to see if it's stopped because you want to give your body time to develop a clot. You want to keep the wound as clean as possible. One thing you can do is wash the wound under a sink for about 2 minutes. If the knife was dirty or if you think the wound is contaminated, you can do it for even longer. You get the cut to stop bleeding and you don't feel like it needs any more care, you can apply a bandage over the wound. If the cut isn't deep, this might be all that you need. Now, when would you want to seek medical attention? Well, if the wound is deep enough and the bleeding is not stopping, that's one indication. If it's what we call gaping or spread open, that usually will require some type of repair. If you take blood thinners or you have a bleeding disorder and you're worried that you might be bleeding more than normal, that's another reason you want to seek medical attention. If you see bright red blood that is pulsatile or shooting out in a rhythmic fashion, this might be an arterial bleed. That could be something potentially serious. If you start to feel like you're losing sensation or your hand is changing color because you're losing too much blood, this could be serious as well. Before we get into laceration repairs in the ER, I want to talk about one thing that I think a lot of us should be carrying. This is called a CAT tourniquet or combat application tourniquet. This is my own that I bought from Amazon and I just keep it in the trunk of my car. It's pretty straightforward. If you're bleeding from an arm or a leg and you can't get the bleeding to stop, you just follow the instructions that comes with the package. Place this 2 to 3 inches above the bleeding site. You want to Velcro it in. This rod basically twists, allows you to go until the bleeding stops, and then you can secure it in place, Velcro it in, and then there's a spot for you to write the time so you know when you put it on and you don't cause any injuries by leaving it on too long. So something to think about if you're looking for some home care. So let's say you end up in the ER because you have a laceration that needs to be taken care of. Well, what's the first thing you might expect? You're going to get an exam, make sure that we're not missing any other injuries. Sometimes we might consider an x-ray if we feel like the bones underneath need to be assessed. If you haven't cleaned the wound, we might clean the wound for you. Now, based on the length, the depth of the wound, you might get a few options to repair it. If the cut isn't too deep and it seems like the bleeding has stopped, then we might apply something called skin glue. This right here is an example of one that's been used before, and it's pretty straightforward how they might apply it. The way this works is you squeeze right here and then you apply the glue over the wound. Sometimes you might need a few layers and you want to give it at least 5 minutes to dry, and sometimes that might be all you need. If that does the trick, then you want to keep the wound dry for 24 hours and you would let the glue slough off on its own. Now, a very common thing we ask when you come to the ER with a cut is, when was your last tetanus booster shot? This is important for us to prevent subsequent infection. So if you don't know when your last one was, and it's been more than 5 or 10 years, depending on how clean or dirty the wound is, you'll likely get a booster shot in the ER. Next, I want to show you how we might repair a wound using sutures in the ER. So here I have different types of wounds here you might come in with. Here's a straight line wound, here's some smaller wounds, and here's some more complicated ones. For the sake of this demonstration, we're going to repair this wound right here. Now, before they get started, they will usually give you a local anesthetic, and that comes in the form of lidocaine or a longer lasting anesthetic. Here's a 2% concentration with epinephrine, and this is a 1% concentration without epinephrine. Depending on your allergies, the length of the wound, your provider will pick a certain concentration and a certain anesthetic. Next, they would take a syringe and a needle such as this, and usually they would draw up some lidocaine. Here I have a 22 gauge needle, which is typically bigger than what most people would use, but it's all I could find right now. So for the sake of demonstration, we might draw up some medication. Now, say I have some lidocaine in here. I would be wearing gloves as well. I might use some pickups like this, and the lidocaine gets injected inside the wound. So your doctor might inject some here. Usually they will aspirate, make sure they're not in a blood vessel, inject, might change the angle, go a little bit deeper, inject, inject. Typically, you're going to have to do it more than once. So we'll do the same thing on this side. Aspirate, inject, pull out a little bit, inject, inject. The lidocaine takes effect pretty quickly. It's possible your doctor might also do a nerve block, in which case they might inject the anesthetic directly over the nerve. Now that the lidocaine is injected, we can get started. Your doctor will choose a particular kind of suture that's appropriate for your wound. Some are absorbable, some are non-absorbable. This one I have here is called the 2O Silk. I'm using this for the sake of demonstration because it's easy to see, but it's not one that I would typically choose for a simple laceration. Now, what's the most common question I get when I'm putting in stitches? It's, "Doc, how many stitches am I going to get?" We usually don't know the answer to that until we've gotten started. It really depends on a lot of variables, such as how deep the wound is, what kind of stitch I'm throwing, whether it's called simple interrupted, or perhaps I'm using a more complex stitch. So we usually don't know. So this is one final look. Typically, after your stitches are placed, you'll get a loose dressing over the stitch. Now, what are the aftercare instructions? Well, most stitches can get wet, so you're allowed to shower with them. We do recommend you keep the area clean and dry. There's a chance that any wound can get infected, so we want you to watch for these warning signs. This might be increased pain, some redness around the wound, or you might even get some pus coming out of the opening. If any of these happens, you need urgent medical attention. However, typically most sutures can just follow up with their primary care physician in 5 to 10 days, depending on how long you were told to get the sutures taken out. Some sutures are absorbable, in which case you don't need to see your doctor at all to get them taken out. However, it's a good idea still to follow up to make sure that the wound is healing properly. That's all for now. Thanks for joining me in this video. If you have any questions about wound care, feel free to leave a comment below and I'll try to get back to you as soon as I can. Thanks for watching and I'll see you next time.